OSHA walked into your dental or healthcare office tomorrow morning, would your team know what happens first? One of the biggest reasons OSHA inspections feel stressful isn't necessarily because practices are unsafe. It's because most teams simply don't know what to expect. They don't know what inspectors ask for, how inspections usually unfold, or where small documentation issues can quickly create bigger problems. And honestly, uncertainty creates anxiety. Hi, I'm Kelli Ngariki, CEO of Healthcare Compliance Associates. And in this video, I'm going to walk you through how OSHA inspections typically begin, what inspectors commonly review in healthcare and dental practices, and how organized offices make the process far less overwhelming. Section 1. How OSHA inspections usually start. One thing many healthcare teams don't realize is that OSHA inspections often begin long before an inspector ever arrives at the office. In dental and healthcare practices, inspections are often triggered by employee complaints, reports of workplace injuries or exposure incidents, follow-up inspections, unresolved safety concerns, or as part of OSHA's scheduled inspection program. And sometimes, employees do raise concerns internally first. But when teams feel unclear about processes or feel like concerns are not being addressed consistently, that's when issues can escalate. Now, that does not automatically mean the office is unsafe. Many practices are simply overwhelmed, understaffed, or operating reactively instead of proactively. Section 2. What happens when OSHA arrives? Let's talk about what actually happens if OSHA arrives at your practice. Typically, the inspection starts with what's called an opening conference. The inspector identifies themselves, explains the reason for the visit, and outlines what they'll be reviewing. Then, they usually begin requesting documentation. And this is where many offices start feeling stressed. Not necessarily because documents don't exist, but because nobody knows exactly where everything is. Some of the most common items OSHA may request include bloodborne pathogens training and compliance records, your exposure control plan, safety data sheets, OSHA injury logs when applicable, eyewash station maintenance and inspection records, and PPE policies. One thing that we see often is practices doing many things correctly operationally, but struggling with organization and documentation consistency. In fact, if you're not sure where your practice stands today, we offer a free 20-minute compliance risk review. We'll help you identify potential gaps, understand your biggest risks, and prioritize practical next steps. Section 3. The walkthrough process. After documentation review, inspectors often perform a walkthrough of the practice. And during this part, they're often evaluating whether safety systems are being implemented consistently in daily operations. Common areas that are reviewed may include sharps disposal, eyewash stations, PPE accessibility, sterilization areas, chemical labeling, and employee safety practices. And honestly, some of the most common problems are surprisingly small. Overfilled sharps containers, blocked eyewash stations, missing labels, outdated documentation, or employees unsure about reporting procedures. Not because teams don't care, but because small operational details slowly drift over time in busy practices. Section 4. What staff should do during an inspection. One of the most helpful things practices can do is prepare employees before the inspection ever happens. Because when people feel unsure, they tend to panic, over-explain, or guess. A few important reminders for teams: stay calm. Answer honestly. Don't guess if you're unsure. Answer only the question or questions that are being asked. Know who the safety officer is, and know where documentation is stored. Inspections usually go much more smoothly when offices have clear systems, organized records, and employees who understand the office's safety processes. Section 5. How organized practices prepare. The offices that handle inspections best are usually not perfect offices, they're organized offices. They have centralized documentation, scheduled training, visible systems, routine walkthroughs, and clear accountability. And honestly, this is one of the biggest mindset shifts practices can make. Compliance should not rely entirely on memory. It should rely on written, documented systems. Because when systems are visible and repeatable, inspections stop feeling like emergencies. Final takeaway. If there's one thing I want healthcare and dental practices to remember, it's this. Most OSHA inspections become stressful when offices are unclear, disorganized, or reactive. Not because practices are bad, not because teams don't care. Most healthcare teams care deeply about safety. The challenge is creating systems that stay consistent even during busy operations, staffing changes, and stressful days. And if this video helped you feel more prepared, subscribe for more practical OSHA, HIPAA, and infection control guidance designed specifically for real healthcare operations.